Hello and welcome to the Feeling Good podcast. I am your host, Fabrice Nye, and joining me here in the Murrieta studios is Dr. David Burns. Hi, David.
Hi, Fabrice.
Dr. David Burns has been a pioneer in the development of cognitive therapy, and he is the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 20 languages. He is an emeritus adjunct clinical professor of psychiatry at the Stanford University School of Medicine. Welcome to episode 97 of the Feeling Good podcast. This is part 2 of our live session with Lee. And so we heard a lot about Lee's story in the last episode. Very poignant and a lot of empathy. So now we're at the point where David and Jill are beginning to think that it's time to issue an invitation for Lee. They've heard a lot about the story and see whether we can talk about something specific. So Jill and David, the first step, I'm not going to divulge it. What is the first step in agenda setting?
The first step in agenda setting is the invitation step.
Yeah.
And, right. So the invitation is really kind of the bridge that gets us from empathy, where we're listening and offering support and kind of following the patient wherever he takes us, to, the invitation is the bridge to then getting to work. And the first question that we want to ask when we ask the invitation is essentially something like a rephrasing of what we've heard. You've talked about kind of A and B and C and offering empathy, and then asking the patient, Lee in this case, do you feel like now would be a good time for us to kind of shift gears and get to work and pick something and really start to work? Or do you feel like you need some more time to talk and explore and get support, because that can be important too? And it's trying to make it clear to the patient that we're not trying to rush him along and throw methods at him and fix him quickly, but also making clear that in order to bring about change, something different is going to be needed, that we have something else to offer other than just empathy.
Yes. And I noticed that Lee was kind of on a roll about telling his story when you issued that invitation, and right on the heels of that, David chimed in with what you call dangling the carrot. David, maybe you can explain what that is.
Yes, dangling the carrot is simply the idea that we have something to offer you, like. You've been talking about the conflict in your current marriage, in Lee's case, and we're wondering, is that something you really want help with? And if so, would this be a good time to roll up our sleeves and get to work? We've got some wonderful tools to share with you, and I have no doubt that if we work together, you can learn how to improve your marriage, for perhaps a great deal. Something along those lines, so that you're offering the patient something positive, something real, and something tangible. Different therapists will have a different way of saying that, but dangling the carrot must be a part of it, because then we're going to deal with two kinds of resistance potentially whenever you're dealing with any target symptom. In this case, it's a relationship problem, and we want to be bringing his outcome resistance to conscious awareness, as well as what we call process resistance, and that's what the main focus of the agenda setting part of the session is. What, if anything, do you want help with? And then can we melt away the resistance that the patient is going to have when it comes time to change?
Yeah.
Fabrice, I was just going to say one more thing. In this case, actually, the invitation felt so important.
Yeah.
And David, I don't know if you recall, but I know as I was listening to Lee, I felt both a tremendous amount of empathy and caring, and felt, like I could listen to him all day, and he was crying and he was emotional and he was lovely. And at the same time, I felt this little bit of tension rising within me that was, I know there's more we can do than simply listen to him. And so I remember offering the invitation in a very delicate way, because I wanted him to feel heard and understood and cared about. And I wanted that option of, if you want to spend more time talking with us today, we would be really happy to hear you. And we could do that. But I also wanted to find a way to pause with all of his story and to make sure that he understood that there was this other option where we could sort of shift gears and start to get to work. So it was so important, in this case especially, where he probably could have just continued to talk.
Yes. And also you did a very important check when before you carried on with the agenda setting. How did you verify that you were done with the empathy part?
I think, if I recall correctly, I think David checked in and said, how did we do on empathy, right? And would you give us, an A, a B, or a C, or a D?
That's right.
How did we do? Do you feel like we really got you?
Right. And so did you get an A?
I think we did, and that's why we decided to proceed, right?
Exactly, because if you hadn't gotten an A, it was like, whoa, and maybe there's something missing here.
Right, exactly.
A quick comment on that. I just did some workshops up in Canada, and at both workshops, not a single therapist had ever thought of asking a patient to grade you on empathy during a session. Most therapists just assume that you're being very empathic and the patient likes what you're doing. But we have patients grade us on empathy after each session. We'll have Lee grade us as well. And when you use the empathy scale that we're using, it's very sensitive to small failures in the alliance, and most therapists discover that they fail with a large percentage of your patients, but they don't even know that because you're resting on your own intuition of how you're coming across to the patient, and that's frequently off base. But you don't have to wait till the end of the session. You can ask halfway through the session, am I getting an A? Am I getting a B? Am I getting a C? And that sounds kind of dorky and dopey, but the patients will give you a grade. I've never had one who won't give you a grade. And if you're not coming across just wonderfully, they'll say, oh, that's a B or that's a B plus. And then you can ask them, well, that's great. Tell me what I'm missing. And then they'll tell you. And then if you, paraphrase that and reflect that back to them, then your grade will generally go up to an A. But it's you can't go on to setting the agenda and to using these powerful methods if you're not getting an A. And I would say this also involves the death of the therapist's ego. I had a co-therapist, Mike Christensen, up in Canada, and we did 2 live evening demonstrations, one at each workshop. And in the second one, we're working with a young man who had public speaking anxiety. And then at the end of the empathy phase, I asked how we were doing. And he said, well, I'm feeling really close to Mike, because Mike had disclosed his own vulnerabilities. But David, I'm not feeling that close to you. And that was painful for me to see that I hadn't really connected with him on that warm human level. He was still seeing me as some kind of expert and maybe a little intimidating. But if you're willing to face that, then when you bring those feelings to conscious awareness, you can deal with them and form the kind of relationship that you want and that the patient wants. I don't know, did I say that properly, Jill? Or?
Absolutely.
As Lee showed his desire to move forward, one thing that you offered to him, David, was that there's 2 ways to go about this. The inner and the outer a solution. We've talked about this in the past, but can you say a very brief word about this?
Yes. Anytime you're in a conflict with someone else, you've got the dialogue with that person, what you say to them, what they say back, and then what you say to them. But there's another dialogue you're having in your head that upset you frequently. And in Lee's case, one of the themes that he talked about from his childhood and from his growing up is, among many themes that can get in the way, but one of them is kind of, I'm not good enough. And so if someone else criticizes you and that hits your trigger point where you feel it in your gut and you feel ashamed and I'm not good enough, then you're going to argue with that other person. And so your inner dialogue triggers problems in the inner solution, and the external solution go hand in hand. You've got to change your inner thoughts and feelings in order to communicate skillfully with the other person. And so we're just asking Lee, did he want to focus the session on overcoming his own feelings of self-doubt and angst, or did he want to focus more on how to connect skillfully and effectively with his wife? And those are both very important issues, and the therapist may very well choose to deal with both of them in therapy, but you have to do them one at a time. You can't do everything at once.
Right, exactly.
Exactly, and they would require totally different sets of methods, right?
Absolutely.
Totally different techniques. And so that's why, again, this specificity is so important. If Lee wanted help and feeling better about himself, not feeling so insecure or triggered, then we would have worked on a daily mood log, and we used a certain set of methods to help him to challenge his own negative thoughts and insecurities and defensiveness versus the external solution where we use a different set of methods, the relationship journal and the 5 secrets.
Yes. And in this case, what you went for was the external solution.
Mm-hmm.
Right. I might say one or two other real quick things about this phase of the session. The outcome resistance in relationship problems that has to be overcome is, do I really want to get close to the person I'm complaining about?
Yeah.
Now, that wasn't an issue with Lee because he really wanted to develop a more loving relationship with his wife. But it's an issue with most patients because in therapy, when a patient begins to talk, I'm talking about when you have one person in therapy, not a couple, but one person, and they begin to tell you about someone they don't like or get along with, most of the time they don't want to improve the relationship. They just want to tell you, what a loser their brother is or their wife or their neighbor or whoever the person is. So that you have to find out, does the person want help or not? And often the answer is not. No, they don't.
Yeah.
The process resistance, which was big with Lee, was if you do want help, who should do the changing? Who is to blame? And that's a very painful thing for the patient, and was for Lee, because he had sent us an email before the session began to say that the problem in his relationship was that his wife was constantly criticizing him and trying to control him. And he thought it was because her mother was very controlling toward her. So he had this whole rationale that he was the one who needed help. In fact, he had initially requested couples therapy. And we said, no, we just work with usually just one person from the couple, which is a radical departure from most marital therapy or couples therapy that insist on both. We would much prefer to work with one person. But then by the same token, he's going to find out what his role in the problem is, and that's likely to be extremely painful for him, humiliating even, and absolutely inconsistent with the way he's been interpreting the reason for the conflict with his wife. And that's also why you need a warm and affectionate, even you could say, or respectful relationship with the patient so that they can endure that. And that, Jill, is why you did such a fabulous job, and always do, in my opinion, in developing that deep level of warmth and trust, because we're going to take Lee to the gates of hell, and we often take every patient to the gates of hell before the recovery can occur.
And so after that, for the next 15 minutes, you went through a series of techniques that I noted, the miracle cure, the magic button, the acid test, and then the interpersonal decision making. Maybe, Jill, you can say a few words about each one of those.
Sure. You can prompt me as well. The miracle cure question is where we say something like, the point of the miracle cure question is to really know what the patient really wants help with, what they envision success to be, and also to kind of catch the patient if they have really unrealistic expectations for therapy, right? If the miracle cure were my wife would, fall in line and stop criticizing me, then we have to kind of refocus the patient's attention on what it is we actually have to offer. But roughly the miracle cure is where we say, if a miracle could happen today or over the course of our work together, and you could walk out of here with kind of just what you want, right? Therapy would be incredibly successful. What would that look like? What would that miracle be? What would we accomplish?
Yeah, and Lee knew about that question, of
yes.
course. But many people will say, well, then my wife will stop nagging me if I get what I want.
Right. Yeah, and then we essentially say, man, I would love that too. If I had a wife denagger machine or apparatus, I would offer you that, but, and warmly and with compassion, we can say, and at the same time, I know that that's kind of not, your wife isn't here. Your wife isn't asking me for anti-nagging lessons, On the other hand, you're here and I have some wonderful tools. And I also feel really confident that if you and I worked together and if you were interested in learning these tools and kind of looking at your role in the conflict, that it would likely bring about really significant change and a lot of warmth and connection between the two of you. But you would have to be the one to do the work and to do the changing. And that might feel unfair, unreasonable. Kind of what do you think? So again, depending on their answer to the question, if it's within what we can offer, then we're off and running and that's fantastic. And if it's not within what we have to offer, then we have to kind of negotiate and be really upfront about what we can offer.
Yeah. The next two techniques we've talked about a few times in the past, magic button, acid test.
Yeah, David, do you want to say something or shall I continue?
You should continue. You're doing just fantastic.
Right. Well, the magic button question is where, again, we say, if you could press a magic button and you could walk out of here and you, in this case, you would have a really close relationship with your wife. Would you want that? And generally the patient will say, sure, that's why I'm here, let's do that. And the acid test is where we'll kind of make sure that that's actually what the patient wants, right? So in other words, your wife would still be critical of you. She would still feel annoyed with you. She might still be nitpicking you, right? And you would want to be close to her. And so we're kind of pointing out the fact that the patient, maybe they don't want that, right? We're really just using methods to try to bring to conscious awareness possible resistance.
Right.
And to make sure that the patient really buys into the solution that we're offering.
Yeah. And on the heels of that was the interpersonal decision making.
Right. So in many cases, that's just where we're offering, what are the different options, right? I mean, you guys, we could work really hard together and bring closeness to your relationship. Another option would be that you could continue to sort of, debate and sort of, hold her feet to the fire and be masculine. And like, we sort of want to lay out the different options and make sure that the patient really buys into what he says he wants. In many cases, interpersonal decision making has option. We didn't bring this up with Lee because it was clear this wasn't the case. But if a patient is complaining and really upset with a spouse or a boyfriend or girlfriend, will often sometimes say, and maybe what you wanted was to leave the relationship, to end the relationship, and we could, work on obstacles to ending the relationship. I'd be happy to help you in that direction. We want to make it really clear that we don't have an agenda to fix the relationship. No. We want to help the patient with really whatever the patient wants help with.
Right. And I want to let our listeners know that I'm spending time on this this section because I think that the agenda setting part is really crucial if this is not done with skills and thoroughness. it doesn't bode well for the rest of the therapy. Don't you agree, David?
Yeah, absolutely. One of the unique features of team therapy, TEAM, is the A equals paradoxical agenda setting, and it's missing from most schools of therapy, and the failure to do paradoxical agenda setting, the failure to bring the patient's resistance to conscious awareness and melt it away or deal with it is the cause of almost all therapeutic failure. The cognition is important, communication with loved ones is important, and teach patients how to do that, but motivation is massively important. And most therapists don't know how to deal with motivation. They don't know how to deal with resistance. They're throwing help at people with depression, or in this case, a relationship problem, or someone with OCD or an addiction, without dealing with the many, many reasons that the patient may actually not want to change or may cling to the symptoms. And with the help of Jill and many others in our Tuesday training group at Stanford, I've been able to develop in the past, I would say 10, 15 years, about 15 to 20 powerful resistance melting techniques so that you can have a patient highly and strongly motivated before you go on to the methods phase of the session.
Yeah. And so even before you got on to the methods phase, you did what's called specificity. What is that?
Well, the specificity is based on a Buddhist concept that's been around for 2,500 years, that if you could change yourself at just one 5-second moment of your life, you would achieve enlightenment. And that Buddha said through all of your reincarnations that you know you're trying to do something that isn't working for you, but just if you could just change it one moment. And what I've seen is that, and this is true in depression treatment, anxiety treatment, conflicts, relationship therapy, that all the patient's problems will be embodied in any 5-second moment that the patient was upset. You see, Lee could have been talking for months the way we did in the empathy session. He's looking for some understanding of his problems. But we'll get 100% understanding from, in this case, what did your wife say to you and what did you say next? One brief exchange is all we need to do highly effective interpersonal therapy. All his problems will be encapsulated. All the understanding will be available when we just look at what's one criticism your wife made and exactly how did you respond to that. And then when we teach the patient how to change for that one 5-second moment of his life, he'll understand the solution to all of his problems with his wife and likely all of his problems with anyone. So although our focus and specificity is very, very narrow, what we're looking for is huge. It will something that's going to impact his entire life.
Yeah, I love how you quote the Buddha, David. You're such a Buddhist scholar.
Yes, I am. I've read nothing about Buddhism. It's just I make up bullshit all the time, and most people seem.
It sounds good.
Yeah, it sounds good. Now, Fabrice, who actually knows a tremendous amount about Buddhism and related things, often points out that I'm up to my neck in BS,
but you don't seem to care, so that's fine, So after that, you started using the relationship journal, which normally I would have put that in the methods segment, but as Lee looked into the consequences of his response, there's some resistance that came up, and then you had to do quite a bit more agenda setting afterwards. Can you say something about that?
Lee or Jill will.
Well, I'm not sure if this is the moment in time that you were talking about, but I was hoping you would ask about this because I remember this really fun moment that happened in the session. So you can redirect us if this is not what you wanted to talk about, Fabrice. But there's this, well, first of all, for sure, on the relationship journal, when you're checking off those boxes and he's realizing, wow, I'm really not being very empathic. I'm not actually expressing my feelings. Yeah. He's kind of buying more and more into the process. But at some point he said something, this really stood out to me. He said something like, yeah, one of the things that I really love about our relationship is that we're really open and we really talk about these things. And I feel like, debating is really important. And it was confusing in my mind, but it seemed to me that he was kind of defending his current communication. And in that moment, I do think the average therapist would want to kind of provide psychoeducation around how debating is really not effective for a relationship or something like that. And I just remember saying something to Lee like, wow, as I'm hearing you talk about your relationship with your wife, it sounds like this debating might, really be effective and might really be useful. And what David and I have to offer you, may be far too civilized. We're talking about, learning skills to really empathize and connect and communicate really differently. It doesn't actually involve debating. And I'm not, maybe that's a bad idea or something like that. And then Lee kind of had this really aha moment, if you remember, and sort of said oh my God, what did you just do? And now I want to give up my debating. And so there's still a lot of paradoxical agenda setting that was occurring as we were working through the relationship journal.
Let me second that, because what you said is just massively important, that the patient may kind of persuade you, I really do want to change, and I really do want a more loving relationship with my wife in this case. But on the relationship journal, what did she say? She made a kind of critical comment that he raised his voice too much with their 18-month-old daughter, and then he responded in a highly defensive way. And then, see, the relationship journal is a 5-step process, and it's not so much about communication, although that's a part of it, but the main thing is interpersonal enlightenment, seeing how you create your own interpersonal reality at every moment of every day. And it's an enlightenment tool, and it's brutally powerful and brutally fast. And Lee had to look at the fact that he was the one who was doing bad communication. He wasn't acknowledging his wife's feelings, he wasn't sharing his own feelings, and he wasn't conveying respect. And that in turn will force his wife to keep being critical of him, to keep making statements that sound controlling, because he hasn't yet listened. He hasn't heard what she has to say, and he hasn't conveyed warmth or love or respect. Well, when you're doing this is step 3 and 4 of the relationship journal, where you analyze how you responded to the person you're not getting along with. And patients will then often start resisting again. And saying, oh, I shouldn't have to do that. I shouldn't have to share my feelings because a man, doesn't have to share feelings. That's sissy stuff or whatever. And the patients, and I have a list of 36 forms of resistance to intimacy. There's 12 good reasons not to share your feelings, 12 good reasons not to be empathic and hear what the other person has to say, and 12 good reasons not to convey warmth and respect to the other person. Like the patient might suddenly say, well, why should I have to treat her with respect? She's been treating me like shit for years. She used the language. I didn't mean to say that. Actually, I did. But the patient starts protesting. And then what Jill so wisely did was avoid the trap of arguing with the patient or trying to help the patient, trying to teach the patient, or trying to persuade the patient. Instead, Jill sat with open hands. That's one of the techniques, and used paradoxical inquiry. Say, maybe you're saying, Lee, that what we're offering is not what you're looking for. You have to be willing to let go and flow with the patient's resistance, become the voice of the patient's resistance, and that's when the magic happens. But this is very difficult for therapists to learn for 2 reasons. First, it's technically a very sophisticated kind of intervention, although incredibly powerful. But in addition, the therapist may be addicted to their own narcissism, your own codependency, and so you don't want to give up your compulsive urge to help and correct the patient.
And I may add to this that in my impression is that when you do interpersonal work like this, resistance seems to creep up over and over, and you have to go back to some form of agenda setting. Every
5 minutes, you'll have to deal with the patient's re-emerging resistance, and that's what the follow-up note, why it's so interesting too.
Yeah. So I think that people are probably tired of hearing us blabbing, and they want to hear the actual session. So we're gonna go on to that, and I think by the end of this segment, Lee is really ripe and ready for the methods. All right, let's hear it.
I feel like the loneliest person in the world. I feel completely misunderstood. I feel different to everybody. Nobody gets me. However, I will say my wife, I strongly believe, thinks I'm a fantastic husband and a fantastic father. I think my ex-wife thinks I'm nothing but a piece of shit on her shoe. But my wife now, I think she thinks I'm a beautiful father and I really do believe that. I'm dragging shit into that.
I have a question, and David, I think you could tell me that I'm making an error, so I could retract my question, but then maybe that will be useful for listeners to see me make an epic fail here. I'll just put that out there. So Lee, what I'm sort of experiencing myself as you're sharing all this with me is that there is so much that's happened, and sort of there's so much I feel like I could listen to today regarding kind of the history with your ex-wife and your current wife, and so many feelings about your relationship with your son. And, that would be a good use of our time today. Like, I would be happy to be here for you in that role and listen and offer you support. And at the same time, there is this part of me that's feeling like, well, I want to at least stop our flow for a minute and check in with Lee and think, should we keep going in this direction? Maybe we'll uncover more. Maybe it would just feel good for you to finally be heard and understood by David and I. And maybe that's kind of all we need to do today. But I want to at least offer you that if you wanted to do more than that, David and I could also help you with probably any one of the things that you've shared with us. Potentially there's something in your relationship with your wife that you might want to work on. Or maybe even some of your self-critical thoughts. I think we could go in either of those directions, but I also really don't want to push you, because I feel like there could be so much more that you just want us to sort of support and listen to you about. What do you think?
And should I say what you did before he answers?
Sure.
I thought that was beautifully done, and just from the point of view of therapists who may be listening, who are wanting to learn, if we're going to transition from the empathy phase of the session to the work to change something, there's an invitation step involved. And I thought you were doing a beautiful job just now of asking Lee right now, is there something here we should be working on today? Because we've got a lot of wonderful tools, and it would be a joy to work with you. But on the other hand, you haven't been understood, and you're getting a lot of things off your chest, and we both like you and admire you tremendously and have an incredible respect for you, and so maybe you need more time just to listen, just to talk and have us listen and provide support before we dive in and work on some of these things.
No, I thought that the intervention it felt really comforting and really respectful and really nice. So I'm fine to move forward to try to do some work on some of these things. It's so funny. I'm just looking at my relationship journal about one little argument I had, and it's just spiraled into like so many different things.
Well, one issue is that we do like working at one little moment. I don't know if you're familiar with fractal geometry. I asked in our workshop last Sunday, and actually there were a bunch of computer people from Silicon Valley at our workshop, and about 8 hands went up that they knew what fractal geometry was. I barely know myself, but it's this, in a simple way, it's the idea that at any brief moment of your life, all your problems are encapsulated, all your individual mood problems and all of your relationship problems. And so when we understand what's going on at any one brief moment, we'll understand pretty much all the problems that are bugging you. And when we help you at one brief moment, we may be able to help you with all of the problems that are going on in your life. But before we dive into, some of that good stuff, I'm always saying, and I want to practice what I preach here, that you've got to, before you go into agenda setting and methods, that's TEAM, testing, empathy, agenda setting, and methods, you've got to be getting an A in empathy. And there's 3 components to empathy. Lee, first, have we understood your statements, your sentences, what you're saying? Did we do a good job of reflecting that back to you? Did we accurately understand how you're thinking about your life? The second part is, did we acknowledge your feelings, your depression, your sadness, a lot of feelings that came up that you weren't having when you filled out the brief mood survey, like the strong anger and the loneliness and the feeling inadequate and kind of feeling like a failure in many ways, and the frustration and discouragement and anger. And then the third point is, did we do this in a spirit of warmth and acceptance? Because you could be a great empathy technician, but as you talked about your father, without a kind bone in your body type of thing, without really reaching out and touching in a kindly and caring way the person you're working with. So how would you grade us in those 3 areas with a letter grade? Because if you say to the patient, how am I doing? The patient will always say, oh, you're doing fine. And they may be inwardly thinking, but you missed this important part. But if you ask for a letter grade, you'll really find out.
I think, I would definitely give you an A on both thought and feeling empathy. I think as well, having listened to all your podcasts and really been blown away by the live work you do on the audio side of things, actually being here, doing the video, seeing your facial expressions and how important facial expressions are in terms of empathy, and you being there with me while I'm effectively having a mini breakdown, right? And you're there, and I can see that concern and that presence and that patience. I thought that really helps. Yeah, really helped.
Great. Well, I'm really glad. And if we hadn't gotten the A, and like you might say, well, you got a B plus in this area or something, then we could say, tell us about the part that we missed. If you're humble and warm and open and respectful, you can almost always get back on track when you get off track. The error is just to think you're doing a great job when you may not be, and not to ask, and then it kind of sabotages the rest of the session. Let me then team up with you now, Jill, in our paradoxical agenda setting, and ask you this question. Jill mentioned that there's a lot of ways that we could be working with you. We could help you, with this relationship journal you had sent me, or any other relationship journal. A conflict between you and your wife, the one that you sent us, was just fantastic, but there could be other equally good examples. That would be the external solution, helping you radically change the way you interact with your wife, and the direction that would go would be that you and your wife are constantly trying to solve problems. And like one of the problems is, who should have some free time or something like that, or who should take care of the baby, or, whatever thing she's criticizing you about. You're trying to improve your behavior, being a better father. And that's actually the cause of the problem. The attempt to solve the problem is the cause of the problem. And the refusal to solve it is always the solution in relationship problems. And we would explore that and show how to convert these conflicted interactions into loving ones. It's very exciting to do. It's also very painful to do because it involves the death of the ego, and you'll have to look at something that, although you've been very introspective, you would see something that you haven't seen that will be extremely painful for you. And I respect you enormously, and I'm pretty sure you would survive that journey and then come into a kind of enlightenment where you could, begin to get that intimacy that you've been yearning for. Also, Jill wisely pointed out that we could work on the inner chat or the inner dialogue that's going on, the things that you're telling yourself that are very painful for you, or we could help you in some other way. So essentially, and I've been too long-winded here. Shut up, David. You're old and you talk too much. Okay, I will. But what kind of help would you be looking for if you wanted some help from us? And we ended this session, and you said, "Wow, that Jill is phenomenal and David is decent." What would happen? What would happen at the end of the session if you said, "Boy, I'm really glad I invested my time in doing that. It was really terrific for me"?
Well, I think in the first hour of us talking, it's obvious that I have a number of key issues that I need to be working on, and that I'm not practicing what I'm preaching in a lot of those areas, particularly around my son and how I feel about that issue. Because if I ask my son, who is the greatest father in the world, he'll say me, right? If I ask him, are you worried, how do you feel about me going to America? He's like, yeah, I understand, right? So there's that I have to work on, which is a lot of inner stuff going on there. But I think what I would like to work on today is how we started out, which is I need to bring that respect back into my relationship. I need to learn how to get back to having an intimate, respectful, connected relationship. Because when that happens, I'm a very happy guy, and I can deal with most things. But if my home life here is, if I'm at loggerheads with my wife, then everything else just goes to rat shit. My relationship with my wife is the most important thing in my life. And I know a lot of people might think to themselves, oh, that's terrible because it should be the relationship with children. I don't believe that. I think if my relationship with my wife is not solid, then my ability to be a good father and a role model to my kids falls apart. So I need to do that. So let's focus on that.
It just so happens, Lee, that I think David would agree. You have two people in the room who could not agree with that sentiment more, that your relationship with your spouse is extraordinarily important. So I think we're with you on that.
But what you just said, though, was that the most important thing in your life is your relationship with your wife.
Mm-hmm.
Yeah,
and that if you could develop greater intimacy, it would help a lot of these other issues as well.
I think so. Yeah,
feeling loved and supported, and feeling like you've got a good connection going on there. Is that right?
Yeah.
Yeah, you said your goal then for our session would be to bring respect into your relationship, or back into your relationship with your wife, to have an intimate, respectful, and connected relationship with your wife.
Yeah, that's what I would like.
So let's imagine then that we have a magic button here, and if you press the magic button, you'll suddenly have the marriage of your dreams. And you and your wife will have, loving exchanges and all this bickering and arguing and, worrying about her trying to control you and being critical of you. All of that would disappear in a flash, and you'd just be happy and euphoric and feel very loved and very loving. Is that a fair magic button question, Jill?
Sure.
Yeah. Would you press the magic button?
It would be there would be a temptation to push it, but I do believe that there are far too many relationships in the world who would press that magic button for many different, and are not confronting their issues. And I think that any relationship has a bit of good love and bad love, or whatever you want to call it. Like you have to disagree. You have to have trials and tribulations. It's just there's no need for that. No need for those conflicts to escalate to a level where they're disrespectful or abusive. So I think conflict in a relationship is really important. So I wouldn't press that button, because if I did, then that conflict would disappear, and then my children would look at a completely, like a relationship that, I don't know, it's not realistic, is it? I need to prepare my children for conflict.
Exactly. All relationships have conflict. So let's redefine the magic button. And Jill will now do this in an incredibly brilliant and clear way.
David likes to put the pressure on me. Well, no, I guess I'm thinking then that what you're saying is your goal. I think what I hear you saying is my goal isn't to no longer have conflict with my wife. And I kind of like what you're saying. In other words, your goal isn't to brush all of your feelings under the rug and to not engage in conflict. But, and I might be wrong in understanding this, but your goal would be to be able to communicate openly about your feelings with your wife, but in a respectful and not abusive way. Is that what I heard you say?
So that the conflicts don't escalate.
Yeah, Liza will regularly say, Lee, I'm pretty sure you love to argue. And I pick through that, and I think to myself, I think there's a part of me that does.
Right.
But I don't want that argument, that conflict to escalate into something where it's the difference between debating and just letting your ego run wild, so you're like really upsetting somebody.
Yeah.
I think for a healthy relationship, my vision of a healthy relationship is one where you say to each other, and you feel open and able to say, hang on a minute. I don't like, you've overstepped a boundary here. I need to talk to you about that, and for me to not be defensive. Like what's happening right now is I'm just being super defensive, which then results in Liza being super defensive, and we just go around in circles.
But I guess I'm not 100% convinced, Lee, that we do have a total working agenda here. In other words, I think what David and I are offering you would be that we would be teaching you skills, tools to really look at your role in your relationship with Liza, such that, maybe you wouldn't be debating things. Maybe I think what we have to offer might be more civilized than what you're looking for.
Right.
What we have to offer might be a little too calm for you. And I'm wondering whether maybe you do want to hang on to your sort of debating style, your maybe more confrontational style. Maybe that feels sort of better and more natural and comfortable for you.
Before Lee answers that question, I'll just ask you who are listeners, particularly if you're a therapist, but even if you're not a therapist, and I won't answer this, but what is Jill driving at, and why did she ask that question? Because Lee is telling us, I want this wonderful thing, and then Jill seems to be saying, maybe we can't offer that. Why in the world would she do that? Let's see what Lee has to say.
Can I answer that as well, as someone who's listening to the podcast? That was the best. That was the best display of someone dealing with the resistance that I've ever heard, let alone been a recipient of. As you were going into it, I was thinking to myself, holy crap, that's how you do it. No, that was fantastic. I don't want to continue with this debating style, because it's I don't want to. It's not serving me.
So you say you don't want to go on with this debating style. By the way, just by way of giving you some support, I have the same tendency that you have of, loving to argue and debate. That's why it was so hard for me to learn the disarming technique, is finding truth in criticism. I really had to work at it. And I remember in my early days of my career, a patient once told me, David, you should have been an attorney instead of a psychiatrist. So that's something we can identify with. But so let's say your wife is being critical of you and controlling of you. Who do you think should do the changing, Lee? You or your wife? Who do you think is more to blame for these problems in your relationship? You or your wife?
I think I think I have to take responsibility, and I know that it's a joint thing, right? Relationships are a joint thing. However, I know how good Liza is at communicating. I know I'm testing her. I'm very good lately. I've been getting better and better at catching it in hindsight. So like I screw up, and literally within like minutes of screwing up, I'm like, whoa, I need to fix this situation, right? So I'm not allowing it to escalate. What I need to do is try to move that before the point of no return. So I'm very, very confident that if I was to learn to develop the ability to be able to just let some of these things that are happening just kind of hit me and flop on the floor or whatever, I'm not explaining it very well, then Liza's will react in kind. I think Liza's reacting to I'm going to say this, and it might sound a bit strange. I actually think I've been a really bad influence on Liza in terms of bringing her down to my level when it comes to arguing. I really do. And I've said that to her a few times and she disagrees with me, but I've said, I see you devolving to my level. And I think that's because she's been with me. She's had to do that. And so I know I'm praising her here, but I stand by it. I think I could sort myself out. We would be okay.
Now we're talking right now about outcome resistance and process resistance. And this is the most neglected area in psychotherapy, and particularly in relationship therapy. Therapists always jumping into the belief that a troubled couple or an individual with a troubled relationship wants a more loving relationship, and often that's not entirely the case, and sometimes it's not the case at all. And then the process resistance issue is what is the patient going to have to do, or client, whatever word, or colleague in this case, going to have to do that he may not want to do in order to develop a more loving relationship, in this case with your wife. How are we doing, Jill, in addressing those two issues? Because it's easy to get fooled, and if we get fooled, we'll run into some pretty intense resistance in a few minutes once we start working with the relationship journal. But what's your assessment right now, Jill?
Yeah, I think that we're doing pretty well. I mean, I guess I think we didn't do a lot to address outcome resistance, which outcome resistance, I guess, would sort of be like, the question of, does Lee really want to be closer to his wife, But I think that Lee, I don't know if we exactly asked that question. I think it's very clear through what Lee has said when he said, the most important thing is my relationship with my wife. Having a better relationship with her would mean the world to me. It's, it's like everything comes from there. So I think we had a pretty, I don't think we have a patient who's struggling with outcome resistance. I think we've had to focus more on process resistance, which started sort of with my question about, like, why would you want to change your style? Maybe debating, suits you really well. I think our style might be a little too civilized for you, right? And then Lee saying, no, I really want to learn to be less defensive. So I think started with that question. And then David, you shared another question about kind of who's more to blame. And I think Lee also did a really good job of arguing that he wants to take responsibility, that he feels like probably his wife actually has better skills than he, that she's been devolving to his level. And I think he did a good job. I feel convinced as well that he wants to work on being less defensive and communicating better. That's my sense. So I think we did sort of address those blame and responsibility.
So we've melted away. I'm sorry, I'm interrupting.
No, go ahead. No, perfect.
So we've melted away Lee's resistance. And now a question for our viewers or listeners. How long in relationship therapy does motivation last before resistance raises its ugly head again? And the correct answer to that is 5 minutes maximal. So we can kind of dive in.
Yeah.
We may want to anticipate that resistance will almost inevitably reemerge.
Yeah.
And that we'll deal with it again. But you've been, tremendously warm and open. But when it comes to giving up truth, your idea that you're right and she's wrong about something, and this incredible desire to point out that she's that she's wrong, we may find ourselves dealing with
addressing
resistance.
it again. Right.
Absolutely.
It's not a one-shot deal, right? We'll revisit it as needed.
Right.
The other thing I thought about then, I don't know if this is relevant, but when you were talking about outcome and process resistance, I thought to myself, oh, am I going to have a problem here with process resistance? Because, and I don't know if this fits into it, but because I'm super, super, super busy, and a lot of these problems are around me being busy, then working on my relationship is actually going to make me more busy. Mm-hmm. Right. So now something has to give in order for me to, it's easy for me to say, oh, my relationship is my number one thing in the world. Yeah. But how true is that right now? And Liza would argue that I'm not telling the truth, that the most important thing in the world right now is the truth about alcohol and strife.
Yeah, I don't see what we're doing as requiring a lot of time. It'll be challenging to you on a different level.
Yeah.
Okay.
Right. Like, whereas, for example, you might be right. If you were struggling with depression, we would be assigning you homework that you would need to do every day, or anxiety.
Right. That's what I was thinking of.
To do exposure. This is a little more we call it kind of like interpersonal enlightenment. Like, we're going to show you something in the next hour. And we're going to ask you to then obviously continue to think about it, but it probably isn't going to take a lot of time to continue to make this change. It will take attention, like continued attention, but I don't think it's a huge chunk of time.
Okay.
But it will require ongoing work to radically change the way you communicate with people and the way you think about conflicts with other people, and the pain will generally comes in the required death of the ego. When I have to do this, I don't like it so much, because when it comes to looking at my own role, it can be fairly shocking.
But maybe we should ask Lee, though. I mean, I wouldn't want to be overly cheerleader here either. So maybe we should ask Lee, like, would you be willing to devote 10 minutes a day to working on your communication with your wife, if that's what it's
Yes.
Yeah, you don't feel like you're too busy for that.
I like that word, 10 minutes.
Yeah. Okay. If you're
we may
working
assign him homework, right, David? I don't want to think that there's no work here.
Yeah, it is going to.
And if Lee isn't willing to devote 10 minutes a day to working on his relationship, well, then that does sort of say something about his interest in changing. Right?
Exactly. But that 10 minutes from someone with your motivation and intelligence and could make a huge difference in your life. Mm-hmm. That would be great. I've never had a patient who did 10 minutes a day of homework who didn't recover from anything. All right. Should we just go ahead and dive in, Jill?
Yeah, let's. So I guess we could say the next place we would be going in the team model then is specificity, right? We've kind of, the first step of specificity was, which problem did you want help with? And you're asking us for help in your relationship with your wife versus, let's say, the internal negative thoughts and feelings. And then the next step would be, could we pick a moment in time when you were having the kind of argument that comes up with your wife that you would want help with, where you didn't feel like you handled it so well, it didn't go so well. So, David, Lee, you did share with us a moment in time earlier, and I think sent us the relationship journal about that moment.
Yeah.
Should we start there?
Yes, please. Yeah.
Okay.
Okay, great. Well, I have a relationship journal here, and I'll publish it in the show notes as well. So if you're just listening on iTunes or something, if you go to www.feelinggood.com, feeling good is one word with 2 G's in the middle. There you can find all the Feeling Good podcasts, including this one, and you can find the show notes. And there's tremendous resources there that will enhance your learning. And you'll see Lee's relationship journal, and you'll see it evolve as our session unfolds now. But the moment that you wanted help with is, I asked you to write down one thing your wife said to you and exactly what you said next that didn't work for you. So this is as specific as it can get. And you said, I was trying to convince my 18-month-old daughter to put her pajamas on. I was calm. Eventually, I raised my voice an octave or two, and in a stern voice, I told my daughter to put her pajamas on. I can identify with that, Lee. Afterwards, Lisa said, I don't think you need to use that tone with a small child. And then in step 2, write down exactly what you said next. And what you said is, I don't think there was anything wrong with what I did. You can be stern without losing your shit. There are times when she needs to know I'm serious and not messing around anymore. It then evolved into a debate over a clash of values on how to raise our daughter. Now, in addition, when you do steps 1 and step 2 of the relationship journal, that one moment, specific moment, I asked you to circle some emotions, which are right there on the relationship journal. How was she feeling when she said what she said? And then how were you feeling? And you said her feelings, she was probably feeling unhappy, also anxious and worried. She also was feeling, you're thinking, rejected and alone, and maybe discouraged, pessimistic, and despairing. And maybe she was feeling frustrated and stuck, and maybe angry, annoyed, irritated, and upset. And then other feelings you were thinking she might have had, she was feeling afraid, troubled, defensive, dismayed, downhearted, and disconnected. And that's a beautiful list. And I suspect she did have most of those emotions in varying degrees. And then how were you feeling, when you said what you said, and when you heard her make that comment to you, critical comment about raising your voice with your daughter, you were feeling unhappy, anxious, worried, guilty, remorseful, bad, ashamed, inferior, inadequate, defective, incompetent, embarrassed, foolish, self-conscious, discouraged, pessimistic, despairing, angry, mad, resentful, annoyed, irritated, and upset. And then a host of other 25 additional feelings: loud, hostile, unpleasant, critical, agitated, reactive, defensive, quarrelsome, short-tempered, stubborn, exasperated, sarcastic, sharp, disrespectful, powerless, diminished, low, despairing, hopeless, fault-finding, resistant, negative, confused, judgmental, argumentative, vulnerable, and inept. What a great.
And this is just
list.
Putting pajamas on a kid.
Yeah.
I've never seen such a fantastic list of emotions that goes well beyond the ones that we usually see. So that was, it shows a lot of insight, and also shows just how triggered you felt in that moment.
Now,
it's good to this forces you to reflect on what was really going on, and then you can see why you reacted. That's what I got out of it straight away.
Right away, just by doing steps 1 and 2, and
very powerful
feelings, you realize just how incredible, just how many feelings and how intense they were for you.
Yeah.
In this moment, which helps to explain then why you had the reaction that you had, which was pretty intense.
It immediately gives me empathy with my wife, and takes me from a conflict to an empathy situation.
Oh, that's great.
That is great.
Now, the goal of the relationship journal is interpersonal enlightenment. Some people think it's about communication, and to a lesser extent, it is about changing the way you communicate and connect with someone so you can enjoy a greater intimacy. But the more powerful thing about it, and the thing you have to do first, it's to see how we're creating our own interpersonal reality at every moment of every day. When you're in a conflict, and if you're watching this or listening to this, and if you're like the rest of us, there are people you get hung up with all the time. You get mad at them, and they get mad at you, and you get to arguing, and And generally we think it's the other person's fault. 80% of the time people with conflicted relationships are blaming the other person. And when you use this tool, you're going to find out that you're actually, and this is strong language, but you're actually forcing the other person to treat you in the way you don't want. And it's fairly shocking to discover it, and can be quite humiliating. At the same time, it's liberating, because if you're willing to see that and let your ego die, then you're also empowered to create intimacy and love and warmth and caring and compassion, rather than, hostility and arguing. Now, on an intellectual level, and this is a very emotional tool, I would say, but on an intellectual level, when I'm working with somebody, I like to say, what is the patient's understanding of what the other person is doing to them? And so here we say, what, Lee, is your understanding of what your wife is doing to you that you find objectionable? And there's two ways to look at it. One is she's trying to control me, and number two, she's constantly critical of me. And then typically what we do, we try to explain why the other person has these faults or flaws, and we see ourselves as the innocent victim. And one thing that you were doing is to say, well, it's probably because of the way her mother raised her that she's like that. And what you're about to discover is her mother is not the one who's causing her to do this to you, but you're forcing her to do this to you every time you interact with her. And we're about to reveal that to you. But before we do that, I just want to ask you, because I like you, I feel very close to you. Would you be willing to have us show you that, or could you endure that?
It's so funny that you said that, because as you was reading relationship journal, did not come up in my head. I was saying to myself, well, obviously Liza's got some serious daddy issues, and she's taking it out on me.
Right.
So,
right.
Yeah, come on, kill this ego. I want it gone.
Awesome.
Do it.
Awesome. Well, Jill will now pull out the scalpel and we'll start dissecting your ego.
I'm going to amputate your ego.
Yeah.
Well, let's start. Let's do this slowly but surely here. So the first thing I want you to do is, Lee, do you have the relationship journal in front of you?
Yes, I do.
Okay, and for the listeners too, I can read to you what we're doing. But the step 3 of the relationship journal is really just, I want you, Lee, to look at this EAR checklist. So EAR the E stands for empathy, and the A stands for assertiveness, and the R stands for respect. So first I want to ask you, Lee, with this definition in mind, so empathy is when we acknowledge the other person's feelings and find truth in what they said. So Lee, when you said to your wife, I don't think there was anything wrong with what I did, you can be stern without losing your shit. There are times when she needs to know I'm serious and not messing about anymore. Were you, in that phrase, were you acknowledging your wife's feelings and finding truth in what she said?
No.
And so we have a checklist here, and if you had, you'd check off good communication. Do you have a pen? Is yours on the computer, Lee?
Mine's on the computer, yeah.
Well, and then you can check off good or bad communication for E equals empathy. And so what you're saying is bad communication.
Right.
So you can put an X in that box if you can do that.
Right. So we're checking off bad communication regarding empathy. And then the next question is, you shared with us that you had a whole host of really strong emotions. But again, when you look at what you said to her, I don't think there was anything wrong with what I did. Were you expressing your feelings, your emotions openly and directly with her?
There's another X going in the bad communication.
Right. So you get a second X, which goes in the bad communication, meaning I failed to express my feelings openly, or I expressed them aggressively.
Yeah, but before we go on to the R equals respect, and this is the EAR checklist, we're going to teach you to talk with your ear, EAR.
Right.
I revised recently the relationship journal to have the checklist of emotions under step 1 and step 2, and just to nail down the fact that you're not acknowledging her feelings or your own, because you had this beautiful list of all of the feelings she was having: worried and unhappy and troubled and irritated and discouraged and all of that, but you didn't mention any of those feelings at all. And that's just to make it, this relationship journal is kind of brutal in a way, because you can't squirm out from under it and start defending yourself. You really completely avoided all of her emotions. And then when you responded, so you had written down at least 15 or more emotions that you were having. You didn't acknowledge a single one of them. And that is so important, because when we're doing this, people often get defensive and say, well, I did express my feelings. I told her to go to hell or something like that. But that's not really sharing your feelings. That's really lashing out at another person. That's attacking another person. And so the EAR checklist and the relationship journal makes it crystal clear the ways that you are failing. And then what's the third? What is R equals respect, Jill? How do you do that one?
Yeah, so I would say that one's a tiny bit less objective, but we're asking you, when you said this to her, I don't think there's anything wrong with what I did. You can be stern without losing your shit. You know, there are times where she needs to know I'm serious and not messing about anymore. Lee, do you think that your attitude toward your wife in that moment was respectful and caring?
Did she feel loved and cared about?
No, at the time, if you would have asked me this, I would have said, yeah, I said it in a respectful way. But now when you can quite clearly see that you've avoided this huge raft of emotions on both sides of the parties, then you can see that it's very disrespectful. It's just, I always say to Liza, why do you always want to have conflict with me? And I can see quite clearly here that I just lit a fuse.
Yeah. And that brings us to step 4. But before we do step 4, because you're saying it already, and you're just super fast and a joy to work with. But is this at all painful for you to see right now? Because you were kind of thinking it was her fault because of her upbringing.
Painful is the wrong word to describe it. More frustrating, because when Jill was reading out about did I express my feelings correctly, I straight away went to a memory of me saying, Liza, because of what you just said, I feel that, I feel something. I've interjected an I feel statement, and the whole vibe of the communication just completely mellows. Liza then just goes into holding presence, understanding, the communication skills training picks in. She picks up the right energy vibe, and everything's great. So I guess it's more frustration that why did I do that when I know I can communicate better? It's almost like, David and Jill, it's a skill that I am acquainted with that I haven't done the work on to make it a habit, and I'm the habit addiction guy. I'm the habit guy, right?
Yeah. Well, we'll talk about resistance and why we don't do these things, and after we've kind of turned this around. But you're in the same boat with a lot of other people. Most people in the world really don't want to move toward love and intimacy, but prefer to communicate in an antagonistic way. And I have this. Jill and I teach this Tuesday group at Stanford, which is free to community mental health professionals who can come and get unlimited free training, and like yourself, free therapy too for the rest of your life. I think it's a pretty good deal we're offering.
Yeah.
And a lot of the therapists can learn the 5 secrets of effective communication to learn to use with patients. It takes several months to get good at it.
Yeah.
But then some of them they're getting perfect empathy scores. We hope we'll get a good empathy score from you, and they can do that and handle criticism from their patients. But then they come on my Sunday hikes, which I also offer to anyone in our training groups, any of the therapists, and then I work with people and do personal work on the hikes. We hike for 3.5, 4 hours, something like that, typically. And on the hikes, they bring up their problem with their boyfriend, their girlfriend, or their spouse, or their mother, and they have a terrible time using the 5 secrets because of intense resistance. And on our Facebook show tomorrow, Jill and I and Mike Christensen will be talking about this incredible resistance people have to intimacy, to love, and why we constantly turn to forms of communication which will force the other person to remain in conflicts with us. But let's focus here on step 4, which is consequences. And you've kind of done this already, but what will be the consequence when she says, I don't think you need to use that tone of voice with a small child, and then you say there's nothing wrong with what I said, and you can be stern without losing your shit. You argue with her, you don't acknowledge her feelings, you don't share your own feelings, you don't communicate warmth, love, and respect. What will happen next? What is the consequence of this type of response?
Liza is immediately going to realize that I have not understood or shown understanding of what she's told me, which then reaffirms her belief that I don't understand her and then never listen to her, which then pushes this, which then increases the space of our lack of connection. So we're constantly trying to say to each other, look, we need to have more connection, more intimacy. And this is just me driving a wedge between it again.
Right.
And then,
Right. And so when then she feels like you're driving a wedge between the two of you and that you're not hearing what she said, will she be more or less likely to continue criticizing you?
She's gonna get defensive. She's gonna get pissed off. She's gonna I guess she's gonna keep criticizing me because she's just trying to get me to listen to her and see what she's trying to say. And
yeah.
Exactly.
So who then is forcing her to criticize you and control you?
Me.
Yeah, is that painful to see?
Yeah.
Okay, why? Tell us about that pain, because if it is painful, then we've got hope for reincarnation or rebirth. But this is the moment of the death of the ego to some extent.
It's painful because for so long in our relationship, I've made her feel like she's at fault, and she started out because she's such a savvy communicator. She started out realizing that I was just full of shit. But as the years have gone on, she's even started to question her own sanity. Is the too strong a word, Jill and David, but she started to question her ability to communicate because it's been going on like this for so long. You know what I mean? She's like been thinking, no, I know that I'm not doing anything wrong here, but Lee keeps telling me that I am. So obviously I am. I must be, and that's making her feel really upset. And
right.
Who would want to be?
Those are some of the consequences of and you're saying that beautifully. What I was asking you is, how does it feel for you to look at this?
To realize that essentially what we're saying in step 4 is, hey, you're causing the very problem that you're complaining about, if you will, if you don't mind that language, right? In other words, You're saying, my wife is controlling me, my wife is constantly criticizing me, and then you're discovering it in step 4. That's because when she says things to me, I'm so defensive and I disagree that she has no recourse but to keep at it, to keep criticizing me, to keep trying to get me to understand. And so I guess we're saying, is that pain, that's sort of like we're saying that's the death of the ego. That's the ego extraction here. Is that painful for you to see that you've been kind of causing the very thing that's driving you crazy?
Again, maybe painful is the wrong word. I feel stupid, a little bit stupid.
Mm-hmm.
I feel a little bit stupid. I can feel the resistance. I can feel a resistance. I'm going to find it hard. I've been wanting to be right my entire life for reasons that go way, way back to being a child. And I think my challenge, what I'm feeling right now is a concern and a worry that I will be able to pull it off. Like, I know quite clearly. I'm looking at this EAR. I can see quite clearly why it's even in that order, right? Because if I just go straight into assertiveness, she's just going to be like, whoa, it's all about you. So I can see it all so clearly, so rationally, so logically. But in that moment, when she's telling me to put that pajamas on, I don't know if I have it in me to be able to just. It sounds stupid. It sounds like. It feels like there's a very male energy involved in it. It's like if I'm going to lose who I am, or the death of the ego, right?
Yeah. Yeah. And you may be saying, Lee, that this is not for you.
Maybe you
Isn't
want
that
to
interesting?
stay in your more manly, domineering, defending yourself mode.
After all, truth is important. You're a great defender of the truth, Lee. Why would you want to give that up? That doesn't make any sense.
Out of all the things I've had to do in my life, giving up smoking, drinking, pornography, sugar, gambling, this is the biggest challenge I've ever had to face in my life. Oh, man.
Yeah, you said it. That's so true.
Put it this way. If I carry on being a man, I'm going to be all alone. My kids, my son especially, will grow up thinking that that's how you be a man. Already, likely at 17, they're ingrained in him. My daughter will allow men to treat her like that. So, no, I've got to let it go. I want to let it go. I want to be the person who is able in that moment to hear what the other person's saying, to understand how they're feeling, and to convey that back to them so they believe that I'm on their side and I'm not their enemy. Particularly Liza, and particularly when it comes to raising our daughter. And I need to be confident enough to be able to explain how I'm feeling as well. So it's not like just a one-way thing. Mm-hmm. I do want to do this, guys. I don't know why I'm having this strange reaction to it.
Well, you just shared with us something I thought was so powerful. I mean, you gave the long list of all of the habits and addictions that you've given up so far, and then said it feels like giving up, being right, arguing, debating, sort of being a man feels like the hardest to give up. It's sort of a habit or an addiction. It sounds very challenging.
Do you know what it is, Jill? What come up for me just then? When I gave up alcohol to try and save my first marriage. And I was in a counseling session when the counselor turned around and directly said, I was surprised, he directly said to my wife at the time, if you don't stop drinking, your relationship will end. And her words were, "I'm not stopping drinking." And in that moment, I felt lower than a bottle of alcohol. Like, love for me was not as important as alcohol. And yet here I was giving like my life up. Like, alcohol was my life. And I was willing to make that sacrifice. And I think what come up for me was I built this narrative in my head that I'm always the one giving things up for people. Like, I've turned that one incident into an all or nothing black and white narrative of I'm always giving up. Why don't someone else meet me here? Why am I the one that has to speak to David and Jill? Why isn't Liza speaking to David and Jill? Why isn't she learning to improve her communication? And I think that distorted way, that unhealthy way of thinking feels like David's going to laugh at me here now. It feels like it's like a permanent part of me, which I know is like a lot of bullshit. I can feel my own bullshit here.
But what you're saying is really true. And there's, I have a list. I have it on my other screen, but I guess I could get it on my screen here. I have two screens. See if.
But let's stick with what Lee's saying. You're saying that really, why should you have to give up being right for Liza? There's lots of good reasons to keep blaming her and to keep kind of holding her responsible for problems in the relationship. Why should you have to change?
Yeah, why should you be the one who always has to do the changing? And really, enlightenment is a pretty lonely road, to be honest with you. And there is a kind of unfairness about it. And whoever comes to us for treatment, that's the person who's going to end up having to do the changing. And then many people will turn away and say, maybe I don't want to change. Maybe this is not for me.
Do you know what I've?
One more thing. Enlightenment is kind of a lonely road in a way, Lee, because you're the one who's going to have to do the changing, and it is kind of unfair. Oh, here I got what.
What were you going to say, Lee?
I can see I'm making two really big mistakes here. Two mistakes I'm continually talking to strivers about on a daily basis that I'm not putting into practice myself. One here is short-term instant gratification versus long-term benefits. In that moment when my wife tells me not to raise my voice to my daughter, I want to put her in her place.
Right. You just stop for a second. So what do we want more, intimacy or aggression? Aggression.
Yeah. In that moment.
Yeah. Fantastic. I love what you're saying.
And that is destroying the long-term goal that I want of having a beautiful relationship, right?
As well as the short-term goal. If you want intimacy at this moment.
Mm-hmm.
But I don't want intimacy in that moment.
Well, you want to be right in that moment, right? But go ahead, Lee. What were you saying? So what you said two mistakes that you often see.
Well, the other one is this. The other one is obviously there's a few things that are really important to me in life. One of them is being a good dad. One of them is being a good son. Another one is being a man. And for as long as I've remembered, I've always felt like a little boy. I went to Burning Man a couple of years ago. We shared a camp with Liza's ex-boyfriend, Randy. And I remember when I looked at him, I just thought, wow, that's a man. That's like a real man. Like he's got muscles and shit and everything. And I'm just and I can feel myself like going Lilliputian style, like, and it's a real issue of mine. And what I'm doing wrong here is I'm stereotyping what a man is very, very wrongly. So I'm saying to myself, a man is someone who puts his wife in place. A man is someone who defends his honor. A man is someone who has his ego. A man is someone who
Doesn't share
always
feelings.
right. He doesn't care about. Yep. A man is someone who employs EAR on a daily, regular basis. It's just, I haven't had those role models around me. I haven't been around enough men who do that. And actually now today, especially since I've given up drinking alcohol, the people I'm around today, the males are like that. Like my male friends right now are very, very empathic and would still fall into the same trap sometimes, but overall they're different. So yeah, I do want to be this. I do want to be this man. I don't want to be the man that I've got this vision of in my head that's right.
You've been teaching us a lot of things here, Lee, but your resistance is one of your bigger gifts, because people wrongly believe that human beings want love and intimacy, and this is almost never the case. And that's what most couples therapists or psychotherapists, relationship therapists don't understand. They try to help people with troubled relationships and aren't grasping the fact that there's overpowering resistances to intimacy and doing the things that are required to change yourself to achieve intimacy. I'll post in show notes. I think I sent it to you earlier, but I may not have, so as not to tip you off. And I've got it on my other screen, but EAR's empathy, assertiveness, and respect. And I've got a list of 12 good reasons not to empathize, not to listen. And of course, one of yours is, I've got to be right. In fact, that's number one on the list. Truth. I'm right and you're wrong. And then I have to be a male. I don't want to be a pussy and give in and be, weak and this type of thing. And then there's 12 good reasons not to share your feelings openly. You also didn't share your feelings. And then there's 12 good reasons not to treat the other person with love, with warmth, and with respect. And these resistances are absolutely intense in human beings. And human beings, we have a desire for love inside of us, a drive for love, for joy, for peace, for intimacy, and which we're having some of that among the three of us today, which feels terrific. But we also have this intense desire to argue, to do battle, to be right, to punish the other person, to blame the other person, to put the other person down. And it just isn't the case that people just have this strong desire for intimacy. It's almost always a tremendous battle, and often the dark forces win. I had one other intellectual point to make, and then we'll go back to this. And another thing about the way you moved us into agenda setting, Jill, was that when you were telling your story, Lee, it was really overwhelming. It was just all of this stuff. And as a therapist, it would be easy to just get overwhelmed. And maybe if we're doing ongoing weekly psychotherapy, that you're coming in and you're venting about your father and all of these things that you talk about with such passion and in such a articulate and compelling way that could go on for months or years, really. And as the therapist, you're feeling overwhelmed. How am I going to help this guy? And then when we come down to just one moment in one interaction, that one on the everything is right here. And really, this is all we have to do, because it's this little fractile, this little unit that gets repeated over and over again and all of the problems that you're having. And so there's also great hope in this model, because if you'd be willing to let us show you how to change at this moment, you then have also the new formula, the new approach, the new philosophy that you can use to change your life in all of these contexts. But again, you said something just a moment ago that was important, that some of your friends are very compassionate like this, but it's not a 100% thing, and that we all, well, I don't know if Jill ever relapses, but the rest of us relapse and fall back into these patterns from time to time. So it's not like achieving perfection, but it's like making a massive shift in the way you relate to other human beings. Is that stated correctly, Jill?
Yeah, absolutely. Yeah, no, I agree with you. I want to see if we can we're doing live therapy with Lee, and then we're also doing a lot of stopping to teach, which I think is great, hopefully for the listeners and for you too, Lee, right? To
Yeah.
reflections. But if it would be okay, what I would like to do is actually, what happened was Lee started to feel some resistance come up, right? And this idea that I have to give up being right and that this is so painful. And then we kind of paradoxed you, Lee, and said, maybe you shouldn't have to change, this feels really unfair, and maybe Liza should be working with us and you shouldn't be the one always having to work so hard. So I just want to read what you said back to us, because basically once you said that, then I would have moved on in our session to sort of step 5. So let's get if it's okay, let's sort of get us back anchored there. What you said, Lee, is like, no, you said giving up my need to be right is the biggest challenge I've had to face. But if I carry on being like this, then I'm going to end up all alone. My daughter will allow men to treat her like this. My son will grow up thinking this is the way a man treats other people. I have to let it go. I want to let it go. I really want to be heard and understood, and I want to listen and understand my wife and other people. And is that's sort of what you sort of sold me on then, even though this feels really painful and really difficult to give up being right and arguing your point, that you really feel motivated to do it because the alternative is being alone and hurting a whole host of people.
Yeah.
Is that where you're at now?
Very definitely. And I just want to say for the listeners or the watchers, you might be thinking to yourself, well, of course he's motivated because he came on, he asked David and Julie if he could do this in the beginning. And there's a completely different feeling to then to now discovering how I'm behaving. Do you know what I mean? Like, yeah. It's like completely different. It feels completely different. I just wanted to make people aware of that. Yes. Now I really, really, really want to embed this knowledge and understanding so it becomes who I am. Yeah. And I wasn't aware of that when I said to you, I need some help.
And generally when people say I want some help with my troubled marriage, what they really mean is I need you to change my screwed up spouse.
Right. Yeah. I need you to get her to stop controlling me. So I think, David, our suggestion then with Lee would be that we move to step 5
right now
on the relationship journal. And step 5 is where we're actually going to try to help you, Lee, and have you help us figure out how to revise what you said.
Okay, good. So that was the agenda setting, and we will hear next time the step 5 of the relationship journal, using the 5 secrets, and how Lee makes some classic mistakes in there, and see how you help him correct them, David and Jill. All right, thank you so much.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this podcast under the blog page, and where you can leave your comments and questions. The website has an abundance of resources for therapists as well as non-therapists, including books, workshops, a list of online training groups around the world, and much more. Theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donsel. I am your host, Fabrice Nye, and I invite you to join us next time for another episode of the Feeling Good podcast.